Hi, I'm Dr. Weng. We're going to talk about preparing for and recovering from a facelift. In the weeks leading up to surgery, for 4 weeks, you need to avoid any nicotine-containing products, including cigarettes, vaping, gum, or patches. For the 2 weeks before surgery, at 2 weeks, you need to stop any aspirin, ibuprofen, or any supplements that may contain blood thinning products. We will have a list for you to review to know which ones of your supplements you need to stop. Another thing to keep in mind is typically after surgery, we ask patients to avoid getting their hair dyed for about 6 weeks. So if you're someone who routinely gets your hair or roots dyed every few weeks, you should plan to have this done before surgery. On the day of surgery, come to the surgery center with a clean face, use a gentle cleanser, and don't wear any makeup. Another important thing is to wear a button-down or a zip-up shirt so that you don't have to pull it over your head after surgery.
I'm Krista. I'm the surgical tech here at Dr. Pontell and Dr. Weng's office. You'll likely meet me for your post-op visits. I'm going to now explain some things about what you could expect after your procedure. So you will have a head wrap that will go all the way around, as you can see here.
Look at us.
It's important that you don't touch your head wrap until you come in, and we'll remove it for you. You also want to make sure that you're not icing anywhere on top or underneath your head wrap. You're just going to leave it alone. If you wear glasses, you want to make sure that you're putting them on the outside of your dressing and not the inside. So your glasses would go like this on the outside, and they would just sit on the bridge of your nose like so. Make sure not to put them under, as they will touch your incision site. You'll be applying the mupirocin ointment yourself once your wrap comes off. You'll be applying that to your suture line, here above the ear, here on the side of the ear. You'll also have sutures here behind your ear. You'll just swipe ointment back here. And then also you might have some sutures here along the back of the hairline that you'll want to apply ointment. So when you come in, we may remove your pressure dressing and switch to an ACE wrap. The ACE wrap is similar to the pressure dressing, just less pressure, covers your incisions, protects everything. Like a so.
You will have several post-op appointments during the first 2 weeks after surgery. The first is to check on the drains and remove the drains. Afterwards, the stitches will come out over several visits. Usually by day 14, all the stitches and staples are out. At that point, it is safe to wear makeup. You can begin washing your hair about 5 days after surgery. Be careful not to scrub or scratch anywhere around the stitches. Just let the clean water run over everything. Most patients will notice some numbness in the skin of the face and around the ears after surgery. This is totally normal. It takes a long time for the nerves to wake up after surgery, sometimes weeks or even a month or 2. We ask you to wait 2 to 3 weeks before returning to exercise. And while your face and neck are still healing, be gentle with any head movements. Don't do any quick turns for the first few weeks after surgery. Some patients ask about getting Botox injected around the time of surgery. I think it's safe to be injected up until the time of surgery and after the stitches and staples are all out at 2 weeks.